guys, welcome back to my channel. This is vlog number 2. If you missed vlog number 1, that was my diagnosis story, so check that out. I'll put a link in the description. But this vlog is going to be my cancer story. So in my last vlog, I left off with, I got diagnosed on a Friday, and I drove back home from my school on Saturday. So on the Monday, I met with my oncologist and I was admitted to the hospital. And my oncologist immediately told me up front that I had to be in the hospital for the first round of chemo, which is 29 days long, because of my tumor, that the chemo kills it so fast that the dead cancer cells don't go through your kidneys fast enough, and so you can get this thing called tumor lysis syndrome. I didn't actually get that, but you have to be in the hospital so they can keep an eye on you. So I was admitted to the hospital on Monday, and at this point I do not know what stage my cancer is in, so it was a very hard couple days. And they just ran a bunch of tests. So with blood cancers, the most important test they do is a bone marrow biopsy. I recommend getting sedation for this procedure. I've heard horror stories of people not getting sedation, so they put you in the twilight zone and they basically drill in the back of your lower back area, and they just take a sample of your bone marrow. And this test pretty much determines what stage you're in, basically. There's a lot more to it than that, but it's a big part of the staging process. And luckily, my cancer had not spread to my bone marrow. Another test they ran was a bone scan, where they inject dye into you and you have to sit through this giant x-ray machine for 45 minutes. And I actually fell asleep from that, so it's just an x-ray, so it doesn't hurt or anything. And then, of course, they do blood tests, and when you have a blood cancer, the most important blood test they follow is your white blood cell count, your hemoglobin count, which is your red blood cells, your platelet count, and platelets help clot, if you get a cut, and your ANC, which is your absolute neutrophil count, which when that gets to 0, that means you have no immune system. Okay, so before I started my actual chemo regimen, there was a big debate about whether I should be on the adult regimen called Hyper-CVAD, or I should be on a pediatric protocol. And my oncologist is an adult hematologist oncologist, and so he consulted with the pediatric hematologist oncologist, and they ultimately determined that since I was pretty young, I was diagnosed when I was 21, I'm now 22, they put me on the pediatric protocol. And it's actually longer than the adult protocol by a couple months. But the good thing about the pediatric one was there's no radiation involved. And you had a better chance of preserving fertility. So I ended up going with the pediatric protocol. And it was supposed to be 7 months long. Mine turned into 10 months. But I'll tell you why later. So the first round is called Induction, and it's 29 days long, and it involved drugs like dexamethasone, which is a steroid, and they actually put me on the steroid before my protocol even started because it reduces the inflammation, and since I was already having trouble swallowing from the tumor, they just immediately started giving me that. And by the time they did a CT scan on the first day of chemo, my tumor had shrunk from 10 centimeters to 8 centimeters. And I was already swallowing better, food and pills, and so that was good. and by this time we still don't know what stage I'm in because the results haven't come in from like the biopsy test of my bone marrow. But I started my regimen on September 1st, so almost a week after I was diagnosed. So that's pretty quick. So the drugs involved in my regimen was dexamethasone for days 1 through 21, which is a steroid, and I get that in the morning, and I would get it at night. I can't remember the dose, but I'm sure it was pretty high. The side effects I got from that drug is ravenously eating, like all the time. Didn't gain a single pound, but I would eat like through the night, just like junk food, like Frosted Flakes and Cheetos, and I would get nauseous like right when they put it in me intravenously, but the best cure for that for me was actually to eat something really sweet. So the next drug I got, I would get, it's called the Red Devil drug. Medically it's called doxorubicin or like adriamycin. But it's called the Red Devil because it's like, it looks red. And that was probably the most harshest drug I was put on, and I had it once a week for 3 weeks. So that's the drug that makes you lose your hair. And so by the 3rd week, I lost my hair. Like, they kept telling me like, oh, some people don't lose all their hair. No, that was not the case for me. So the next drug I had was vincristine, and that has been the one drug that's been consistent throughout all my rounds. And during the first round, I got it once a week as well. And the first time you get that drug, the doctors warn you about jaw pain. And I was like, I got this. It's not going to affect me. No. I got the worst jaw pain in my life. Like, ice packs wouldn't help it, morphine wouldn't help it, nothing helped it first. So for 3 days, I was in like really bad pain. And yeah, that was a bad 3 days. And the last drug I was on was called methotrexate, but it wasn't through IV. It's called intrathecal chemo, which is they give you a spinal tap, and then they take out your spinal fluid, and then they inject the same amount of the spinal fluid they took out with methotrexate. So spinal taps, you just gotta lay down for like a couple hours or just take it easy for the whole day, basically. But for some reason, my first one, I don't know what happened, but apparently I had a spinal fluid leak in my back somewhere, and I had a spinal headache, which if you've ever had that, it is so bad. I was dry heaving, I was nauseous, and the way that they fix that is called a blood patch. So all the dry heaving was happening at like midnight, and so they took me in for a blood patch at like 2 a.m. And what a blood patch is they draw out some of your blood and they just inject it into the spinal tap spot, and instantly it was fixed. So yeah, if you ever have a spinal leak, ask for a blood patch, because they don't usually do them. So yeah, in conclusion, spinal taps suck. And I had to get those tests done once a week, basically, in the beginning. And they send off your spinal fluid to get it checked for, see if the cancer cells made their way into it. And luckily, mine did not. And about 2 weeks into the first round, we found out that I was on stage 1. So that's a blessing in disguise, because they usually don't catch my cancer until it's stage 3 or 4. So, because it's very aggressive. So I was really lucky in that respect. Okay, so the first round was 29 days. So it started on September 1st, and when you get chemo for a blood cancer, all your blood counts that I mentioned earlier, like your white blood cell count, your hemoglobin, platelets, and ANC, they begin to drop and drop and drop and drop and drop until they get to 0. And when you get to 0, you're considered neutropenic. You have to wear a face mask. You basically can't go anywhere like out to eat. You have to go on a special diet, like no raw fruits or vegetables, no salad, no fried eggs. You have to have scrambled eggs only. Basically everything has to be cooked through. And so like no fish, like no sushi. So yeah, and originally my oncologist told me I was going to be neutropenic in the first round, but for some reason I didn't get neutropenic. And so he actually sent me home early. So I did 3 weeks in the hospital, and then he sent me home for the 4th week. And I began to do outpatient, and I was actually, I almost didn't want to leave the hospital because I was so scared to be at home, and my parents are teachers, so they had to go to work. And we're going to have all these different people taking me to all my appointments at the outpatient clinic. And I just basically had one giant anxiety panic attack for like a week straight when I went home. And by Friday, they readmitted me to the hospital and gave me IV like anti-anxiety meds like Ativan. And I was in the hospital for about 3 days for that, and they sent me home on a Sunday. So Friday through Sunday I was in the hospital, and that was the end of my induction phase of chemo, so the first round. So the second round is called Consolidation, and it's really long. It's the longest part and hardest part of your treatment. So with Consolidation, I was on drugs like vincristine, which I mentioned earlier. I wasn't on the steroid anymore. I was on this new drug, to me, it's been around for a while, called cytarabine, and those were shots in the stomach. And that drug made me pretty nauseous, and I have a lot of anti-nausea medication. The one that works best for me is Zofran. And at first I had just the pills to swallow, but I was having so much anxiety about everything that I just couldn't swallow pills. And who wants to swallow a pill when they're nauseous? So I asked, I kind of researched and asked for sublingual dissolvable Zofran pills. So you just pop one in your mouth and it dissolves on its own, which works great. So if you have a lot of nausea, I recommend getting the dissolvable pills. So vincristine, cytarabine, and I think that was it. Oh, and this other drug called pegasparginase. If that's hard for you to pronounce, we just called it the Pegasus drug. And I got that about twice in the first part of the round, and then twice in the second part of the round. So before I mentioned about neutropenia, which is when your blood counts drop all the way to 0. So round 2 started on October 3rd, and it was supposed to go all the way through like December 1st or something like that. And I only made it to October 17th, and I was neutropenic by then. And when you're neutropenic, you have to take your temperature like 3 times a day to make sure you don't have a fever. if you have a fever over 100.4, you are basically required to go to the emergency room. So on the 17th, my mom actually decided to take that day off from work, so she was with me. And I woke up from a nap. I was doing fine in the morning, took a nap. And in the afternoon I woke up, I was just sweating so hard. And so I took my temperature and it's like 101.5 or something crazy like that. So went to the emergency room. I was admitted pretty much immediately because my vital signs were pretty bad. And they always take blood cultures, and these tests check for bacterial infections, fungal infections, or viral infections. But those tests take like 2 to 3 days to come back. And so they admitted me to the oncology floor, and basically they were trying out all these different meds on me to see if they work, because the antibiotics weren't working, which kind of scared me. And so like 2 or 3 days later, I'm still not really doing great, and they found out that I had a fungal infection. And this particular fungal infection is called, it's hard for me to pronounce, candidiasis, decimated candidiasis funganemia, which is when the fungal infection decimates into your bloodstream. So basically, I was on my way to septic shock, and that was pretty scary. Actually, I lost my ability to walk for a while, which was really hard for me to handle emotionally. And I ended up passing out in the shower at one point, and it was just hard. They finally found the medication that worked, and that was just an IV medication. And yeah, I was in the hospital for that for about 3 weeks. And in the meantime, because hospitals are dirty, I contracted C. diff. If you don't know what C. diff is, it's basically diarrhea. It's horrible. And imagine having diarrhea when you can't walk. It was just gross. I was in isolation, so anyone that came in my room, including my family, had to put on gowns, masks, and gloves. So it's basically a freak of nature. And yeah, my fevers finally subsided. The medication they put me on was called micafungin, and they gave me 100 milligrams every morning. And so it finally worked, and I kind of regained my ability to walk. So after 3 weeks, on November 7th, I was sent back home. But before that, my PICC line was infected because it got in my bloodstream. And so they had taken out my PICC line, and they gave me a port instead. I don't know if the camera can see it, but it's right here. It's this little circle thing that sticks out of my skin. And to me, ports are way better than PICC, so if you're going to be on long-term intravenous medication, get a port. And so they sent me home. I actually had my port surgery the day I went home, and it'll hurt for a while, but eventually it stops hurting. So I went home. I'm still on this IV medication called micafungin, and instead of having to go to the outpatient clinic every single day to get this medication, I ended up doing home health, which is when a nurse comes out to your house and they do the medication for you and access your port. Your port has to be accessed once a week, so to keep down infections. And so a nurse came out the first day, taught me how to do the medication, I didn't want to learn how to do my own port, so I just had a nurse come out once a week and they redid my port once a week. And in the meantime, my chemo protocol stopped completely. So I ended up finished the recommended 6 weeks of this IV microfunction and the bridging maintenance chemo. During that time, I had vincristine twice and intrathecal chemo twice, which is the chemo injected in the spine. So during that time, I actually felt pretty good. Like, I did my laundry a couple times, had more energy, and I got to, my Christmas was pretty good. Like, I could enjoy it. And so they ended up rescanning me like January 3rd, and scan came back okay. I still had some infection around my kidney, and but I was still in remission, which is the main thing. And they decided to put me back on my chemo protocol, but I was to remain on the IV antifungal medication, microfunction, and for like forever. I didn't actually stop that until like June. And so I started right where I left off in consolidation, so week 4 of consolidation phase. And I finished that up like February 1st. And yeah, I had like a week off or something like that. And then I started interim maintenance phase. And that's also 2 months long. And originally I thought it was going to be easier. Like, the chemo was going to be easier on my body, because on paper I was getting just chemo every 10 days instead of like 2 or 3 times a week. But they introduced a new drug to me, methotrexate, which is what I get in my back, but that doesn't give me side effects, really. But this time I was getting methotrexate in IV form, along with vincristine and occasionally pegasparginase. And through the whole round, basically, I was just nauseous. Couldn't eat. My weight was horrible. Couldn't gain weight. Was losing weight. And in the meantime, I had an eye infection called preseptal cellulitis, which can get pretty serious. And he put me on like 4 antibiotics. So a pill antibiotic, eye drops antibiotic, eye ointment, which you have to like lift up your eyelid and put this gel stuff in it, and IV antibiotics, which I had to go to the clinic for every single day for 7 days. And around the 3rd day of that course of antibiotics, I was just throwing up every time I took my pill. And so I ended up like texting my oncologist, and I was like, I can't take it anymore. And he's like, okay, you don't have to take the pill. But I was on the other antibiotic stuff for 7 days. And so that finally cleared up. I was still nauseous. I had an ER visit because I was having severe abdominal pain. And I went, they scanned me. Nothing showed up on the scan. So they gave me morphine and Zofran and sent me home. A couple weeks later, I finished interim maintenance phase, and I was gonna get 2 weeks off, which is pretty good. And around the 2nd week, I got the flu, influenza B, and I can't believe they even found out I have the flu, because at my appointment, all I said was, I have a scratchy throat and maybe a little bit of a runny nose. And they just screened me for all these tests, and I ended up having the flu. So I was put on Tamiflu, and about like a week into that, so they delayed my chemo for another week. So now I was gonna have 3 weeks off. And so, like the day before I was supposed to like start my next round of chemo, I had severe abdominal pain again, and this time it was worse. And I couldn't even stand up straight. And so I went to the ER, and they scanned me, and guess what? Guess who had appendicitis? Me. Who gets appendicitis during cancer treatment? I was so mad. And at the same time, I was neutropenic, which again, that means you have no immune system. So basically I had to have emergency surgery with no immune system. And people get infections all the time during, like, after surgery with a full immune system. So imagine what it was like for cancer patients that have to get surgery. And so, of course, during this time I still had the flu. And when I woke up from my surgery, everything went fine. I woke up from my surgery in pain because of the incision sites, of course. But I was also in that coughing stage of the flu. And so if you've ever had abdominal surgery and you have to cough, that pain is so horrible. It's like the worst pain of my whole entire treatment, basically. And they had me on like morphine, Dilaudid, I can't remember the other one, but yeah, they had me on all this pain medication, and I ended up getting an infection, and they kept me for like 5 days and put me on antibiotics. My actual general surgeon was like ready to like send me home after like the first day. My oncologist was like, nope. And I ended up getting an infection, so I guess my oncologist was right. And so he sent me home, gave me another week off. So by this time, I had spent a whole nother month off all chemo, which is good and bad. I mean, it was supposed to be a rest period, but obviously it was not. So by this time, it's around like April 25th or 30th, around there, and I start the next round of treatment, which is another 2 months. And this treatment is called delayed intensification, which is very similar to the first round of chemo. So I was on like the red devil drug, which makes you lose your hair. So I had to shave my head again, and it has not grown back. It is now August, and it had not grown back. So I ended up shaving my head around like May, early May, sometime around there. And my dad actually shaved his head in solidarity, which is nice of him. And everything went okay. I finished around like mid-June, and I had like a last day at chemo like party at the clinic a little bit, even though it wasn't technically gonna be my last day of chemo, but it was my last day of the really intense chemotherapy, like the initial treatment process that was supposed to take 7 months, but ended up taking 10 months because of all my delays. So like everything was fine, we were all happy, and the next day, guess who got a fever? Me. So I had to go to the ER. They admitted me. They figured out I had a bacterial blood infection, and I was in the hospital for 10 days on standard antibiotics. And yep. Okay, so I spent 2 days in the hospital, and the reason I got this infection, which you might not want to know all the details, so if you want to skip this part, it's kind of gross. So I was neutropenic when I finished my last day of chemo, which means you have no immune system. And I was just the chemo was affecting me in a way that I was going diarrhea all the time. Because when you're neutropenic, they actually put you on antibiotic. I was on Levaquin to prevent like infections from happening. Obviously, it didn't work, which is my next part of the story. So I was going diarrhea all the time, and I ended up having like an anal fissure, which is a tear in the lining of your anus. And when you get something like that and you're neutropenic, like, it's hard for it to heal because all your healing cells are gone. Your bone marrow is not producing anything. It's not producing white blood cells. It's not producing platelets. Your cuts can't clot, so you're just going to keep bleeding forever and ever. So the next day after my last day of chemo, I got a fever. It was like 100.5, which is 0.1 over when I have to go to the hospital. Like, if it's over 100.4, you have to go to the hospital. So it's 100.5, and so I had to go to the ER. So they did, blood tests, blood cultures, which take 2 to 3 days to come back. In the meantime, they put me on broad spectrum antibiotics, and I was in pain from my anal fissure, so I was on pain meds as well, which make you constipated, by the way. They then scanned me, and they were like, your bowels are really full, so we're gonna give you a laxative. And when you're in the hospital, they don't just give you like Senecot or whatever, or Duclax. They give you like a hardcore laxative. I think it was called Supra or something. But it's like this like syrupy drink. You have to drink it. And it makes you go diarrhea for like 24 hours straight. And yeah, that was horrible. And I was also neutropenic, so they weren't going to let me go home until my body started producing like neutrophils and white blood cells and platelets. And I was getting like blood transfusions, platelet transfusions. My potassium was really low because I was pooping so much. So I was constantly getting potassium infusions, and those are 4 hours long each, and I think I got like 2 or 3 of them. And yep. So like around the 4th or 5th day in the hospital, I was still neutropenic, and I had already been neutropenic for like a whole month, which is concerning because really it's supposed to go up after like 2 weeks. And so they gave me white blood cell stimulator, bone marrow stimulator, called, the generic name which I got is called Granix, but most people know it by Neupogen, and there's actually a commercial for it. And so yeah, I got those shots in the stomach for like 5 days, and finally my body started producing white blood cells, platelets, and everything else. And yep, I was sent home on July 1st, and I had scheduled my final scan, okay, which is a big deal in the cancer world, your final scan. And it was going to be a PET scan / CT scan. So I went in for that on July 11th. And how that works is you have to go on this weird non-sugar diet the night before. It's a weird diet. Like, all I could have to eat was like chicken and lettuce. So in the morning, they inject you with, I can't remember what it's called, but for a PET scan, this stuff they inject you with is glucose related, so it attaches itself to any thing in your body that is producing lots of cells fast. So if you have a tumor, it'll attach itself and it'll light up on the PET scan. And so I had my PET scan, and then I had a clinic appointment across the street, so I went to that, and like literally, like not even 30 minutes into my clinic appointment, my oncologist comes to see me. He's like, it's not cancer. At least that's what the radiologist told him. And he's like, it's not cancer, don't worry about it, but you need to have these lymph nodes removed so we can prove it's not cancer. And what they thought it was like an inflammatory or infectious thing. But I had these like giant lymph nodes in my groin, which is weird because like the week before that I was having pain in my groin. So the scan showed that, but it also showed like spots in my liver, spots in my kidney, my pancreas, abdominal cavity. I had skin lesions all over me, and so of course I think it's cancer. But they kept reassuring me it wasn't, and I had surgery on July 14th to remove the lymph nodes, and that sucked because I couldn't eat for like 24 hours. But the surgery went fine. I woke up in pain, gave me more pain meds, everything's fine. I went home the same day. Got the results about a week later. It wasn't cancer, so that was good. But it wasn't anything else. Like it wasn't bacterial, it wasn't fungal. They don't know what it was. And yeah, my oncologist basically was like, didn't do anything about it. But they had to take those lymph nodes out to make sure it wasn't cancer. And when you have a cancer scare like that, you want to do everything possible to like prove it's not cancer. And so if you have to have surgery, you have to have surgery. So I recovered from that, and then the last part of my treatment is called maintenance chemo. So maintenance chemo is a really long process. It's 2 years long, and I just started it, so in my next vlog I will talk more about that. And currently today it is August 27th, and I just moved into my dorm, and school starts tomorrow. And in my next vlog I will talk more about that. But for now, be kind, be thankful, and be courageous.